Most health insurances are very good about allowing a regular annual physical exam, and that's a time when you can spend with your healthcare provider, your doctor. You can talk about your health. When you're not having problems, you can mention things that are going on. You can just discuss with them and have a nice general conversation about different things and when you should have these particular tests done. Some of them are yearly, some of them are more often, some of them are less often than every year. So, a lot of times having that baseline done is really good to do as well, because then you know where you're at early before anything happens, and then if something does happen, your doctor can compare those exams and go back and look and say, hey, well, when we did this 2 years ago, here's what your numbers were, and now your numbers are here. I have a concern over this. And so there's a baseline for that doctor to be able to look at and see if there's something that they need to do differently or more testing that needs to be done.
Heart disease is the leading cause of death in men, accounting for 1 in every 4 deaths. After that, according to the Centers for Disease Control and Prevention, are lung, prostate, and colorectal cancers. The good news is that these health threats that men face are largely preventable. Early detection, though, is key to preventing and treating cancer. A K-State Research and Extension Family and Consumer Sciences agent has written a publication that says that a little time spent now with early detection testing and changing to a healthier lifestyle may allow men to live a long, healthy life, doing the things that they enjoy well into retirement. Unfortunately, men are less likely than women to have seen a doctor within the past year. That means that these types of cancers are not being detected before they become a more serious health threat. On today's Sound Living, K-State Research and Extension's educational effort to help men take steps to prevent, detect, and care for themselves to have a healthier, more fulfilling life. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. K-State Research and Extension Family and Consumer Sciences Agent for Nutrition, Food Safety, and Health in the Wildcat Extension District, Holly Miner, has authored a Men's Health Guide fact sheet which covers early detection and prevention of 3 types of cancer: prostate, colorectal, and testicular. Miner says that the guide provides practical advice to help men defend against these types of cancer. Holly, maybe some background on this fact sheet. How did the idea for this come about?
We know that preventative health is really important, and women are really good about doing preventative health, but men don't often like to go to the doctor. And so we wanted to bring awareness to the men and their families and help them be able to understand what some of the preventative medicine or preventative tests that can be done to help them prevent diseases and things like cancer or heart disease and those kinds of things, to help them be able to stave those off a little bit longer or catch them early.
That's key, isn't it, the early detection?
It is. It absolutely is. I've had several friends that have gone in for regular checkups, and they have found out that they had prostate cancer or colon cancer just in a regular checkup. And so being able to treat that early rather than waiting for symptoms that might happen later when the symptoms finally do start to show up, and then going in at that time, their diagnosis and prognosis is so much better.
The Men's Health Guide that deals with cancer really looks at 3 types of cancer?
Yes, we look at prostate cancer, testicular cancer, and colon cancer.
In terms of prostate cancer, what types of information is included there?
Well, in all of the cancers, we look at what it is, describe the cancer, what some of the symptoms might be, where it's located at, and factors that might increase the chances for that prostate cancer or whatever type of cancer it is. And then we look at how to determine whether they have that particular cancer or not through the screening process.
In terms of prostate cancer, I know one of the things we talk about is age being something that normally comes into play.
Right. So it's really recommended for men that are ages 55 to 69. At age 70, the research shows that men of that age or more should consult with their healthcare profession for screening recommendations. So really that 55 to 69-year-old male is who we're really targeting this information for as far as prostate cancer goes. unless they have an increased risk. And then that's always something that you want to talk with your doctor or your healthcare professional about. If you have risks, and some of those are age, if you are African American or Hispanic or of Native American descent, your risk increases. So men of those descent need to talk with their healthcare provider, and maybe they get tested a little bit earlier. If you have a father or a brother that's had prostate cancer, you're more likely to develop that too. And so heredity plays a part into that as far as direct family descendants that have that as well.
And one important point here is the fact that if there is an enlarged prostate, that does not necessarily mean that there is cancer.
That is correct. That is correct. Anytime that you have something out of the normal, you should see your healthcare provider and just get checked out to make sure that everything is okay.
There is a blood test that can be done for this, but as you were saying, sometimes you really have to have the full exam.
Right. You know, I had a friend that just had this done within the last month, and he went in for a regular exam, and they did the test and found out that he is actually at stage 3 cancer. So he had no symptoms for a long time, and they caught it, and he told me the other day that he thought his prognosis was going to be really good. So it's important to get that screening done.
And colorectal cancer, the same type situation?
Yes. Colorectal cancer is the third most frequently diagnosed cancer in both men and women, and 9% of the cancer-related deaths are related to colorectal cancer. So it's important to have that done whether you are a man or a woman, but I think men put things off a little bit more, so just making sure that we have that testing done and are doing those preventative exams is important.
There are some risk factors here as well that may come into play?
Yeah, again, just like with prostate cancer, if you have a father or a brother that has that cancer, then you're more likely to have it. Being obese, drinking a lot of alcohol, or using a lot of tobacco are also risk factors. And then if you are an African American man, it may increase your risk for colorectal cancer as well.
And there are a number of screenings that can be done for this as well.
Right. There are several different types of screenings. The best thing to do is to work with your healthcare professional to figure out which one is going to be the best option for you. That way you can work through that together and choose the one that's going to be the most effective.
And I think they'd like you to start testing in your mid-40s for this?
Yes, around the age of 45. Again, if you have some of those risk factors, your healthcare professional may ask you to test earlier than that. If you have any symptoms, you definitely need to go in and be checked as well. So these age ranges are important, but it could be either side of that, depending on risk factors and just your general health overall.
For testicular cancer, what type of things are we looking for here?
Treatment depends on the specific kind of testicular cancer. So those kinds of things are important to look at as well. Testicular cancer is usually a younger man's cancer. So between the ages of 20 to 35 is when most of that happens. It's a very, very small chance of occurrence. So testicular cancer is pretty rare, but it is one that we're becoming more aware of. And I think it is one that if you do have problems, you know, it's definitely a concern to you and one that we want to take care of right away as well. And I have a friend who has had this type of cancer as well, and they are doing really well after they've been treated for it.
And this is something that you can self-check for, right?
Right. You know, when you're taking a shower, when you're warm, it's a great time to test for it. When you're relaxed, if you feel any lumps or if you have any swelling or hurting in soreness in that area, then you want to talk with your healthcare provider. If your chest or your breasts grow or are sore, that's also a sign that could be from that. Shortness of breath, any kind of chest pain, headaches, confusion. There's all sorts of different symptoms, and a lot of these symptoms, it's hard to say that it's because of this or because of that because they're very common symptoms that could be for a lot of different problems that you might be having. So sometimes it's hard to diagnose for that reason or to pinpoint it for that reason, and you may be having some of these symptoms and it may not be that at all. But again, we want to stress the importance of being tested. This is a preventative test, and we want to prevent anything from happening or going down the road too far where your prognosis is not as good.
A lot of this is kind of reminding me, you were talking about sometimes men don't like to go to the doctor, and sometimes we only go when we are in pain, but I think what I'm hearing you say is if we stick with those regular yearly annual checkups, we'll be a lot better off.
Yes, we definitely need to do that. Most health insurances are very good about allowing a regular annual physical exam, and that's a time when you can spend with your healthcare provider, your doctor. You can talk about your health. When you're not having problems, you can mention things that are going on. You can just discuss with them and have a nice general conversation about different things and when you should have these particular tests done. Some of them are yearly, some of them are more often, some of them are less often than every year. So, a lot of times having that baseline done is really good to do as well, because then you know where you're at early before anything happens, and then if something does happen, your doctor can compare those exams and go back and look and say, hey, well, when we did this 2 years ago, here's what your numbers were, and now your numbers are here. I have a concern over this. And so there's a baseline for that doctor to be able to look at and see if there's something that they need to do differently or more testing that needs to be done.
It's also starting to be shown through research that having a healthy dietary pattern is also important.
It is. We want to eat those foods that are going to help us be able to, especially for colorectal cancer that have a lot of fiber in them that can help us go to the bathroom easily. Eating a heart-healthy meal is important too, and we talk about some of the other things that are of concern to our health, cholesterol and high blood pressure and those kinds of things. Eating a variety of fruits and vegetables. We want to make sure that we're including dark greens as well as all of the colors of the different fruits and vegetables. Each one has a little bit different nutrient value, and so having a wide variety of those is important. Fruits are also important in that aspect. Whole grains give us a little more fiber, and they help us feel fuller. So if we're feeling like we're hungry, if we eat a whole grain versus a regular bleached or enriched grain, it will make us have more nutrients as well as gives us the fiber that we need in our diet. And then, of course, we want to choose foods that are fat-free or low-fat in the dairy group. So the skim milk or the 2% milk versus the whole milk or the regular yogurt. We could choose a lighter yogurt, those kinds of things, low-fat cheese. Soy products or soy beverages are also alternatives in the dairy group. So if you have lactose intolerance or need to have something a little bit different, those soy beverages are a great alternative for that. And then in the protein foods, we want to include foods that are lean. So lean meats and poultry and eggs, seafood. We can also look at alternatives to meats such as beans and peas, lentils, those nuts or seeds, and then any dairy and soy products can fit in as a protein as well. And we always want to limit the amount of sugar, salt, and fat in our diets. So all of those things are important too. And then when we're talking about a healthy lifestyle diet, we need to talk about the amount of alcohol that we drink and drink that in moderation. So, it's different for men as for women. So just being very conscientious of being in moderation with that as well.
Really what we're trying to focus on here is the fact that men can take a little bit more control of their health and maintain their health for as long as possible.
Right. Taking these steps to prevent and detect any problems that might be occurring before you actually have symptoms is extremely important. And so these preventative tests done on a yearly basis or semi-yearly basis or whatever the recommendations are for each testing, talk with your healthcare provider, figure that out, and we want you to live a long, happy life, and, having good health is important for that.
That's K-State Research and Extension Family and Consumer Sciences Agent for Nutrition, Food Safety, and Health in the Wildcat Extension District, Holly Miner. Miner has authored the Men's Health Guide fact sheet, Cancer, Early Detection, and Prevention. That fact sheet is available online from the K-State Research and Extension Bookstore at www.bookstore.ksre.ksu.edu. That's www.bookstore.ksre.ksu.edu. Or you can find the fact sheet by contacting your local county or district extension office. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.